Morning everyone, Shraddha Vasnik here. In last lecture, we studied about the absorption of drug and factors affecting on it. In today's lecture, we study about the distribution. Then distribution. Drug after the administration or absorption are widely distributed in the body. Distribution means transport of drug to their target tissues, that is site of their action. For the distribution of drug, the body fluid and the solvent act as a vehicle, and drugs are widely distributed in the blood and the tissue. And there are some factors which affects on distribution are P square R square, which means P for plasma protein binding, second P for physiochemical properties of drug, R for route of administration, and second R stand for regional blood flow. First is plasma protein binding. So what do you mean by plasma protein binding? The drugs are distributed in the blood and body fluid. In the blood, the drugs are bound to the blood constituents such as albumin, globulin, that is plasma protein. These binding of drug with the plasma protein known as the plasma protein binding. Then, importance of plasma protein binding. It affects the fate of drug. Then only unbound or free drug reaches to the site of their action. Then plasma protein binding increases the duration of action. The drugs which have greater plasma protein binding are able to displace the drug with weaker affinity. Then physiochemical properties of drug. Physical and chemical properties of drug affects the process of distribution, like solid dosage form, liquid dosage form, crystalline dosage form, amorphous dosage form. Then route of administration. As we know, the parenteral route of drug administration is very effective as compared to oral route of drug administration, which means the drugs which are administered by the parenteral routes are widely distributed to the organs and the tissues than the drug administered by the oral route. Then regional blood flow. Blood supply varies or differs from tissues to another. The distribution of the drug directly proportional to the blood flow in the tissue or the organs. Then metabolism of drug. Metabolism means the conversion of one drug into the another chemical form in the body with different or no pharmacological activity. The metabolism of drug takes place in the liver. Then excretion of the drug. After the absorption, distribution and the metabolism, all the drugs are excreted outside the body by the various organs. The excretion is mainly defined as the process where the drugs are transferred from the internal environment to the external environment. It involved kidney, lungs, skin, bile and milk and saliva. Kidney. The process involved in the urine formation are glomerular filtration, tubular reabsorption and active secretion. Majority of the drugs are excreted in the urine. If the renal function is impaired, then the concentration of the drug in the body increases, which causes the drug toxicity. So, kidney plays an important role for the excretion of the drug. Then, lungs. Excretion of various gases, inhalants, volatile substances, general anesthetics are excreted by the lungs. The substances like alcohol, are excreted by lungs. Then bile. Through biles, drugs like erythromycins are excreted in urine in small quantity but appears high concentration in the bile. Then skin. The metal like arsenic, lead are excreted by the skin in small quantity. Arsenic get deposited in the hair follicles and concentrated behind appearance of the skin rashes is due to the excretion of such metals through the skin. These are the factors or organs which are responsible for the excretion of the drug and the metabolism of drug and distribution of drug. In distribution of drug, plasma protein binding plays an important role for the distribution process, and in excretion, kidney it is the important organ or mainly the drugs are excreted through the kidney. In next lecture, we will study about the factors which modify the drug